Hello, I am Dr. Vasudeva Juwadi. I am a consultant orthopedic surgeon at Citizen Specialty Hospital, Nalaganla. I specialized in complex trauma and robotic joint replacements. Today we are going to discuss about robotic knee joint replacements. A lot of people have a lot of doubts about robotics and how it will be, will the robot do the surgery, a lot of questions. Today we are going to answer all the questions for you. Knee joint is formed between thigh bone and leg bone. At the ends of the bone there is cartilage which is very smooth. As the age goes on, there is wear and tear of the cartilage. So there are different stages 1, 2, 3, 4. At the fourth stage the cartilage is totally worn out, so which causes pain and severe restriction of movements to the patient. Such patients are ideal for total knee replacement. So what do we do in total knee replacements? We don't totally change the knee. We just remove the worn out cartilage at the ends of the thigh bone and the leg bone and place it with artificial implants, and in between the implants we put something called poly. That is called total knee replacement. Lot of people have doubts regarding what is the difference between traditional total knee replacement with robotic total knee replacement. In traditional total knee replacement, we attach some specific jigs to the knee joint which help us making the cuts according to some prefixed measurements. These prefixed measurements are based on general population. But in robotic knee replacements, we take a CT scan of your knee. So that is the thing. In robotic knee replacement, the preoperative planning is most important. We take a CT scan of a knee so that we get a 3D image of your knee and we put it in the computer. We get a measurements how much to cut according to your knee. It doesn't depend on general population. These measurements and cuts will be specific to your knee. So, and while doing the surgery, we fine tune according to your soft tissue balancing and all, and we fix the cuts and make the cuts according to the measurements given to your particular knee. It doesn't depend on the general population. So that is most important, and that is the difference between the traditional total knee replacement and robotic total knee replacement. So in OPD, a lot of people ask whether there is real advantage of robotic knee replacement over traditional knee replacement. Yes, definitely robotic knee replacement has an extra advantage over traditional total knee replacement. In traditional total knee replacements, we use a jigs and do some measurements with eyeballing. So there is definitely some human error of 2 to 3 degrees, and when cutting the bone also with the saw, there might be human error of 2 to 3 degrees error can happen. But in robotic technology, we take a CT scan of your knee, put it in the computer, and when operating also we fine tune and we have a perfect measurements which we need to cut. So when we are cutting also, we have something called haptic technology in our Mako Robo, which will only let us cut what need to be cut. If you try to push also, the robotic arm doesn't let you push it more than what needed. So with this, perfect alignment is made, perfect accuracy is made, precision is made. For any knee replacement surgery, two are most important: maintaining a perfect alignment and perfect soft tissue balancing. With the Mako Robo, we can achieve both with 100% accuracy and 100% precision. So as the patient gets proper good alignment with a good soft tissue balancing, the post-op recovery is very soon and patient can go back to his normal activities and can do all his routine activities. So the patients are happy. Happy knees, happy patients, happy clinics. A lot of people have a myth that robot do the surgery. No, robot doesn't do the surgery. Computer helps us. We do the pre-op planning in the computer, and with the robotic arm, the surgeon, we only do the surgery, but it helps us in doing the surgery properly. A lot of people in the OPD ask me, will there not be any kind of pain after robotic knee surgery? See, any kind of surgery you do, there will be some amount of pain. But when compared to total knee replacement in a conventional way, there is less pain for robotic total knee replacement. The reason is we do very less soft tissue dissection. So definitely the pain is less. Coming to the risks of Mako robotic surgery, there are none. But theoretically, when we put pins in the femur and tibia, there are risks of some stress fractures, which is very rare. In our practice, we have seen none, but to be frank, to tell it theoretically, that is the only complication which we can face. Post surgery, the recovery is faster with robotic knee replacements. Generally, the patient tends to walk without any support and start doing his routine activities by 6 to 8 weeks. So these are the few basic questions which people ask us in OPD who are undergoing macro robotic surgery. I think I have answered all your questions well. So thank you. See you again.